We are seeing more and more Syrian patients in the corridors of this hospital, originally set up in 2006 to treat wounded Iraqis.
I was injured by a bullet that went right through my chest and came out of my back. I spent 4 days in a coma. The bullet went in here and came out here. It pierced my right lung, my liver, my gallbladder, my intestine, and damaged my sciatic nerve.
The conflict in Syria is intensifying, and working inside the country is impossible. MSF is therefore providing treatment to wounded Syrians who managed to cross the border into Jordan.
And so, obviously, this only concerns patients who can physically make it across the border. It's very, very clear that the most serious surgical cases are still in Syria, and for the moment have no way of crossing the border.
Unlike the Iraqi patients who need reconstructive surgery, the Syrians mainly need treatment for bullet wounds, and this usually involves orthopedic surgery. To cope with the inflow of refugees, a trauma unit reserved for Syrians will be opened shortly with capacity for 50 patients a month. More than 65,000 refugees are gathered here in the Beira camp in Mauritania. These tents in the middle of the desert are providing shelter for the families who have fled Mali and who have little hope of returning in the near future.
Every day it's a struggle to get water. I spend long hours trying to find something for my children to drink. Give us water at least.
Poor hygiene conditions, together with a lack of food and water, are undermining the health of the refugees.
Among the patients who come to the centre, we mainly see people with acute respiratory infections. I mean breathing problems, lung infections. They represent about 44% of the people who come to us. Then there are the diarrheal diseases, because of the water, because of hygiene problems.
The children are suffering from malnutrition. MSF has already been treating them for 4 months, but the needs are still huge. Because in addition to those of the refugees, there are also the needs of the host population already struggling to cope after a poor harvest. And with the rainy season due to start in July, delivering aid will become even more complicated. For the last 2 years, several villages in the north of Nigeria have been cleaning up this lead dust, but there is still much to be done. MSF, which is treating contaminated children, estimates that 1,500 of them are still being exposed in the village of Bajega. Lead poisoning is a serious health hazard which can prove fatal.
Children are more vulnerable to lead poisoning because of one, they usually play on the ground and they're usually close to the source of contamination itself. And children also have a small blood volume. As such, any little amount of lead they take will therefore concentrate in their blood and cause high contamination.
Last May, MSF organized an international conference and called on the Nigerian government to resolve the crisis, notably by releasing the $4 million it had promised for cleaning up Bajega and making gold mining safe. Since this conference, the Environment Minister has approved the release of these funds. But the emergency phase is not over yet. Some villages have still not been cleaned up, and others have been recontaminated. This mother has just arrived at MSF's Drouillard Hospital with her young daughter. Like many of the children here, this little girl has been severely burned by hot food.
This little 7-year-old girl was scalded by a pan of spaghetti this morning. She was brought here by her naturally distraught mother. About 15% of her body is covered in burns.
This 30-bed unit admits a new burn victim every day. It is the only specialized burn unit in the country.
For adults, the cause is usually an exploding gas container. When you're living in a tent, there are lots of things that can set fire or explode. Plus, people are cooking in their tents. There are explosions, or a candle that can start a fire. And then there are electrocutions when people touch loose wires or plug sockets and get an electric shock, and it's usually very serious.
There was a fire here in this camp. 3 people died and other victims are now being treated in Drouillard. They'll need regular dressing changes and skin grafts for several weeks. They'll also be offered physiotherapy as part of their rehabilitation. This clinic provides treatment and counselling for women, but also for children and sometimes men who are victims of sexual violence.
Initially, we used to have from 20 to 30 patients in a month. After going for extended hours and 24 hours, today we are getting 100 plus new cases in a month. Most of the cases are happening from 6 p.m. up to midnight.
The figures quoted by Michael Juguna reveal much about the violence that occurs here.
The perpetrators were 15 men that had assaulted a 17-year-old girl. This is the most that we've seen. The youngest survivor that we've seen in the clinic was a survivor of 3 months. And the oldest that we've seen was 84 years old.
The victims who come to the clinic are met with a warm welcome and someone who listens to them. They are then offered a medical consultation and treatment to reduce the risk of HIV infection. But many cases are still not being reported. The shame and the red tape keep many victims from speaking up.
Even if you're a survivor and you want to follow the legal justice system, then you find that there is a lot of loopholes and there is a lot of long waiting for the perpetrator to be arrested and to be prosecuted.
Despite these difficulties, people are slowly beginning to open up, and the team believes that their presence here is now accepted. Every year, cholera epidemics in the Beaufort region spread a little further and last a little longer. Until now, the oral vaccine was only administered as prevention before the first cases appeared.
We usually work on the treatment of cases, and we try to do something on the prevention, especially on the treatment of water and the prevention of the spread of the disease. However, all of these actions have very little impact on the actual spread of the epidemic. This is the first time that we are using cholera vaccine in such an emergency and reactive vaccination campaign.
After this vaccination campaign, MSF and Epicentre will monitor the effectiveness of the vaccine for 6 months. The results will be used to develop a strategy for dealing with future epidemics. The teams hope that by using this vaccine in conjunction with prevention, hygiene measures and treatment, they will be able to offer a more effective response to the disease.